Welcome to another episode of Plastic Surgery Uncensored. I'm your host, Dr. Rady Rahban, and we have a fantastic episode for you. It's a fantastic episode, not just because all of our episodes are fantastic, but because I'm very excited about the subject matter, because I think it's a subject matter that's very relevant and very poorly discussed. And I think we're going to have such an incredible dialogue about revisional rhinoplasty. So any episode we have, if we have a patient who's willing and courageous enough to come on the show, it's just that much better than me just babbling on my own. So I'm grateful to you, Chloe, for coming today. We've known each other for quite some time, right?
We have, at least 4 or 5 years now.
4 or 5 years, yes. I had the pleasure of meeting you for a primary nose, right? You came to me and you said, hey, Dr. Rahban, actually you came with your parents who just left, who are lovely people. I just adore them. And it was a dialogue about, hey, I have issues with my nose I don't like, and I'm contemplating fixing it. You and I went through the analysis. We talked about what I saw, what you saw, what we thought we want to do, and lo and behold, you opted to go ahead and proceed with surgery. So fantastic. I think that we did that in 2020,
yes.
Right?
Yes.
So we operated on you, and for the most part, you were happy, right? So take me through. So we did your rhinoplasty, and talk to me about like the outcome in terms of like, I didn't like it, I did like it. What was it like?
I think, initially, I always appreciate your approach that we're not trying to match a Photoshop image,
right.
That we were really trying to figure out a nose and proportions and features that were going to match my face.
Sure.
And so we discussed, I felt very prepared going into the surgery because you didn't set unrealistic expectations for me, but we also were on the same page that I wanted a very natural look, and especially immediately before the surgery. Right. I just felt very validated and felt good going in.
Which is really important, right?
Right.
To me, like, I'd never get my nose done because I have trust issues and I'm such a picky person, I would never be able to do it. But the idea is like, you go to sleep, you wake up, and your face is not the same.
Right.
And that to me is such a massive leap of trust and faith that is just mind-boggling, and I never take it for granted that this person basically goes to sleep and based on a conversation, I'm gonna alter their face. So it really makes the patients, I think, be able to go into it with greater ease if they feel like we're on the same page, and as you had said, feel confident that, you know, you understand what we're doing.
Right. And I think for me personally, having the education to really understand what you were doing from a technical perspective
Sure.
was also, I think it's different for everyone, but for me that was very helpful just to really understand the steps, the process, how you were approaching it. So I felt confident going in, prepared. I've seen all your before and afters.
Sure.
In general, was a big fan of the work. And I liked the result. The result was great afterward.
Right, but the result took a little time,
and
right?
It took some time. And then it also, and I think this is something I didn't realize about rhinoplasty, is that you have your initial result, but it's going to keep changing
Sure.
over the course of that first year or two.
So if we go back to our consult, if you remember, and this is something that I do in all consults, I get to the area where it says risks, and I go bleeding infection, super rare, scars, tiny little incision, nobody sees, difficulty breathing, septum, turbinate, whatnot. And then I write irregularities, asymmetries, contour deformities. And then I circle it. I have this very specific thing that I do. And then I translate for you, what does that mean? And I write, your nose will not be perfect.
Yes.
Remember that?
Yes.
And then I say to you, and you're like, what does that mean? I mean, here's your current nose. Your nose has got a bump and a nostril is bigger and it's downward, whatever it was. And here is your nose if you and I were to draw it on a computer, right. AKA a Photoshop or Morph, which is super common that I don't do. This is your nose on that computer. It's perfect, meaning it's straight, nostrils match, it's high, low, whatever you want. So when you're done with your surgery, irrespective of the surgeon, you're going to end up somewhere in this vicinity, which is, let's say, 80% of the way there. Right. If you're a generally reasonable individual, yes. which I myself am not, you'll say, well, holy shit, this looks better. I mean, this is way better than it was before.
Yeah.
It's not perfect. The nostrils are a little off and maybe it's a little crooked, but it's so much better. I'm happy. And then I'm happy and you're happy. That's what we do. Yeah. But there are some individuals, they fall in that 20%. They're nitpicky. Oh, it's better, but like, no, I got this thing here and that thing there, and they will be unhappy. And I tell them, don't do your nose. If you're a picky person, I'm a picky person. Don't do your nose because it will have issues. Not maybe.
Right.
It will have issues. And as a result, you'll end up thinking this was a waste of time. So I tell that to everybody. And then we also talk about how long it takes for your nose to heal. And I say, you have a 1 week, a 2 week, a 6 week, and a 1 year follow-up.
Yes.
And then I say a 2 year, a 3 year, a 5 year, and a 10 year.
Yes.
Well, what the hell am I coming at 2 years and 3 years and 5 years? And what do I... You think I see my breast dog at 2 years, 3 years? I don't. I only see my nose. And the reason I see my nose is at 2 years and 3 years and 5 years is because the nose is a pain in the ass. And unlike other areas, it takes forever to heal, 18 months, 20 months, and it keeps changing.
It does.
And it's one of those things that's incredibly frustrating as the surgeon and incredibly frustrating as the patient. And as a result, so many surgeons don't do rhinoplasty. They just don't do it. The time and money I make, I could be doing 5 breast dogs. It would be 10 tummy, like there's a million other ways to be spending my time. I do it because I love noses, but because of its unpredictability, what unpredictability? There's healing, there's scar tissue, there's contracture, the nose changes way more than you would imagine. And unlike a breast that changes, nobody notices it. Like no one's like looking at their breast and staring at it and my right nipple and no one's staring at their tummy tuck. But the nose is smack dab in the middle of your face, and the slightest changes are going to be notable. Whether they're good or bad is notable. So you did your nose, and then you were coming to your follow-ups. I'm like, how do you like it? You're like, I like it, I like it, I like it, I like it. And then at some point in these follow-ups, because I keep following you, right? Because you would have gone out to see. 9 out of 10 surgeons, after like 2 months, they're like, it's been great. Call us if there's a problem. Right? So you're out and 5 years has gone, 6 months, 7, 8 months go by. And if you're having an issue, you actually have to call them and make an appointment. Whereas on our calendar, you're coming in.
We were actively just like tracking progress.
And in one of those events, what happened? And I don't remember, it was probably at your 3 year.
Yes. And I think it was like both of us looking at the nose together, and there was just a little, on one side, there was a raised bump. That we were both could like, it was becoming a little bit bigger. It was becoming more noticeable.
So there was an area in your nose around 3 years that was becoming a little fuller and noticeable. And kind of throwing off the aesthetic a little bit. Right? And this is the most important part about this episode. It's when and how do we deal with ideas of revision in general and in particular with noses. So you said to me, and I remember this very vividly, like, hey, Dr. Rahban. I'm like, how's it going? You're like, it's going pretty good. And this is going to be very important for you to hear if you're a patient out there. You didn't come to the consult guns blazing.
No.
You didn't come to the consult agitated, irritated, inflamed, argumentative. You didn't come in and say, hey, so hi, Chloe, how you doing? I'm upset, Dr. Rahban. Well, okay, what's the matter? Well, you see this thing here? Well, what is this thing? You didn't do that. Because had you done that, a normal surgeon, which is a normal person, would get defensive. They're a person. So if you come out of the gates and all of a sudden start complaining and you're argumentative, don't be too surprised that your surgeon is defensive. And then they're going to be like, what do you mean your nose looks so much better? And then we go and get your photos, and then we look at your photos, and it's unarguable. Right? It's unarguable that you look way better.
100 times better.
Right? But it's also unarguable that this thing is there. Right?
And I think too, from, on the non-medical perspective, I'm just seeing it in my daily life. How I kind of approached it was like, maybe there's a different solution than surgery for this. Maybe there was other options, or maybe surgery was the option. But I just wanted to come in and get all my options explained to me.
Sure, but what I want to highlight really for people listening is the way and the manner in which you approached it is very important in that it sets up a circumstance
Yes.
for you to start having a dialogue with a good surgeon so that you can address such a thing. So you say to me, hey, Dr. Rahban, I go, how's it going? You say, it's great. I go, how's your nose? You go, I love it. It's great. I noticed that this bump is forming. I'm like, and then a good surgeon, when you have a good patient who is not being aggressive, should be like, yeah, actually, you're right. I do see that. And what did I say? I said, yeah, actually, I do see that. And that's like really annoying. And I'm like, well, this is probably some scar tissue and some changes in your cartilage that's forming over time. Let me take a closer look.
Yes.
So I'm not defensive. I'm not argumentative. Generally, that's, it doesn't fall on the patient. But definitely if you come in agitated, you're going to agitate your surgeon.
Right.
And then we started having a dialogue. And I said, well, okay, yeah, this is kind of shitty. This is like having a scratch on a Ferrari.
Yes, exactly.
Right? Is that what I said?
Yes.
It's like, here you have this Ferrari and it's got a big scratch on it. And the question was, what can we do about it?
Right.
And in your instance, really the only thing was one of two things. Leave it alone, or I have to go back and revise it.
Yes.
Right? And so this is really important for people to understand. Revising a nose is super difficult. Patients think you just go back in and shave that thing down. And that's absolutely not what happens. You have to open up this hood of this car, which is glued on, right? Your super thin skin.
Yes.
Which makes every little irregularity 1,000 times more visible, right? If you had thick, oily, sebaceous skin, we could leave a quarter in there accidentally and nobody would see it. But since you have paper thin skin, every little couple of millimeters, like, what is that thing? Yes. So we have to peel open the skin without damaging it. And then there's a wad of scar tissue and these pieces of cartilage all glued together. And then we have to dismantle what we did and rearrange it in a way that's more desirable. So surgeons, when it comes to revising a nose, are generally much more reluctant than if you are revising other things. It's not just purely because we're defensive. It's just like, well, shit, this could go wrong.
Right. The risk to it.
Right. So then you have to have a conversation with the patient. You have to say, well, we could go back and fix it, but here are the risks associated. And the risk is it could get worse.
Right.
You could have necrosis. You could create new issues that you didn't have, etc. But in your instance, what was our dialogue?
I mean, it was very, very open. And what I always appreciate when I'm in this office with anyone is like, we're working as a team to try to like make the best decision together. That's how I felt.
Sure.
And you were giving me all the risks. And what I was like, what is the percentage that we're weighing of like the good versus bad outcome? And when we were reviewing all those options, there was a much higher probability that we were going to have a good outcome than a poor outcome.
Sure.
And I was really going off having trust in you and that you've seen this many times before. And like the odds were likely that we could get a better result than what we had.
Right. So this is really important now for the surgeon side. So the patient part is, if there's something that comes up, approach your surgeon with kindness. If globally you're happy and something is not exactly the way you want, treat them like you would some friend or family member who spent a lot of time and energy trying to make you happy. So don't come in there complaining without even at least acknowledging that you're so much better. From a surgeon standpoint, you can't gaslight a patient. You can't be like, come on, Chloe, you're so much better than before. Let me bring out your photos. And I could get all inflamed, right? And I could be all defensive and irritated and insulted. And frankly, I also can be like, wow, I don't want to open this thing up because I don't want to deal with this shit.
Right.
There's not a lot of money in it, right? For a surgeon, like we don't charge you almost anything, right? Because you're my patient. It's my policy. My policy historically is, since my revision rate is small, I'm not going to end up trying to charge you $1 million to fix something that we already spent a lot of money on. I just want you to be happy. So there's no money in it for me. So I can be really like, try to discourage you.
Right.
But a good surgeon's going to look at it in his mind or her mind and say, can this be better? Yeah. And the truth of the matter is that you're a beautiful girl. We did this rhinoplasty. The nose changed, which is no one's fault other than the process. And I had to ask myself, do I feel that I could go in there and improve this and give this patient, instead of an A minus, an A or an A plus? And I think that that's something that each surgeon has to ask themselves. And because you're such a lovely patient, it was worth it for me to do, because the inherent risks, you were the type of person that I'd be willing to take that in. You see, patients don't understand their contribution to it. If you're a difficult person and you're challenging and very nitpicky, do I want to open up your nose a second time only to have it create new problems? You damn well know I'm not going to. Right. But if you are sweet and open-minded and reasonable and understand the risks, and we do it collectively, then I'm more inclined to want to do that. Because as a surgeon from the beginning, your goal should have been what? To get the best outcome possible. And sometimes, and with rhinoplasties, often it isn't the first time. So the revision rate in rhinoplasty is by far the highest rate. There are papers that say it's well over 20%. Thank the Lord, my revision rate is substantially less, but it's not zero. Obviously not, right? I'm gonna do hundreds of these, and if I'm just par for the course, 20 of them are gonna need to be revised, let alone less. I'm just gonna wanna make sure that I revise them in the people that it's got a possibility of being a good outcome.
Right.
The right patient. We have people who call in all day long who want revision rhinoplasty, and I say no because it's their third time redo, revise. There ain't no way I'm gonna make this better, no matter how much money they're willing to pay.
Right. And it's really just about having realistic expectations that, I mean, I don't think we're gonna have any more here, but if you're on your third or fourth, you might be pursuing something that's not realistic.
Yeah, and it gets harder to get the outcome. And so it's not that you're unrealistic. Yeah, I see a lot of things wrong with your nose, but no one's going to be able to fix that. And the surgeon should be able to tell you that the likelihood of me making it better is small. The likelihood of me making it worse is high. This is a bad investment. Yeah. So the next thing is, so you had your surgery in 2022.
Yes.
We did your revision in 2024.
Yes.
Right? Was it 2024 or 2023?
It was last year, because we're a year and a half, so 23.
Right. Okay, so what that tells you is that it was a long ass time. That's critical. You do not, and I underscore, do not want to do a nose job and within 5 months be freaking out and demand a revision rhinoplasty. The reason you don't want to do that is because there's so much inflammation and so much scar tissue in there that the dust has yet to settle.
Yes.
And in your instance, luckily, your issues were not so dramatic that you were like besides yourself. No. But one of the things that led to your successful outcome, aside from you being an easygoing patient, aside from me being a good surgeon, is that time was on our side.
Yes.
We waited and you showed up and we operated on you when your skin envelope was soft, the scar tissue had settled, and we had more of a probability of getting it right the second time.
Yes, and I actually felt like that was one of the best decisions we made together, because I came in maybe at like the 18th month mark, and I still waited like 6 more months after that, just to really like be sure of the decision and make sure that it wasn't gonna get worse, and it didn't get worse, but it wasn't gonna get better either on its own.
You know, and I think that's really important that you can't do that when a patient's coming here demanding and screaming and yelling. So the purpose of this episode is to underscore all the key elements. And one of the key elements is patience. The patient themselves being a great candidate and being one that you want to go that little extra mile for. The second is surgeons that are not going to get offended and gaslight and be angry that a patient wants a revision. And the last is, if you're going to go for it, to create an environment that's going to lead to the possible, the best outcome if you're going to do it, right?
Yes, absolutely.
So now you're out how long?
We're about 1.5 years out.
Great.
From when we originally.
Let me see your nose. Oh, I love it. Fantastic. You look gorgeous. And I'm kind of irrelevant. Do you like it?
Yes. It's
better?
Even better. It was great. And then this is like the best version of it. And even if I had decided to not do the revision, it would have been okay, but I'm so glad we made the decision.
Yeah, no, listen, and the purpose of this isn't to say that you need to keep going until it's amazing.
Right.
This was something that was fixable.
Yes.
Sometimes the things that we don't like are not fixable. And then the reality is that good enough is good enough.
Right.
I'm saying that if the patient and the surgeon are correct, when things are good enough but can be better, then you should go for it. When the patient is not a good patient, the doctor is not a good doctor, or the circumstances don't lend themselves, then listen, good enough is good all day long.
Yes.
No problem. The enemy of good is better. So you don't want to push it if it's not indicated.
Yes.
So I thought this was going to be a great episode because I think it's a subject matter. I mean, because I do a lot of noses, we get 10 inquiries a week of revision noses from outside our practice. And unfortunately, I really only operate on maybe 1 or 2 because I feel wholeheartedly I can't help them. And I don't want to take their money when patients are desperate.
Right.
Right? Because those patients we charge more to because it's very complicated. Yeah. We have to take rib and ear and fascia and da-da-da-da-da. And so I don't want to do that because they're vulnerable. Tell them, just blow smoke up their,
right.
And then just be like, well, I tried. I told you it might not be better, right? So we've actually had somebody who got angry that I wouldn't operate on them, which is ironic. But nonetheless, I'm game for when I think it's doable.
Yes. And I think for people listening, it's really important to trust what your doctor is telling you. You know, if you're saying, I can't do it, you should trust that.
I mean, what do I have to gain by that? I don't really understand that one. It's like, I can only...
Upset, it's like you're looking out for their best interest.
Yeah, they were actually upset that they had sent in what I try to do is not even waste their time, right? The only thing I screen are revision rhinoplasties. So I have them send photos free of charge.
Okay.
I look at them and then I tell them if they should waste their money on a consult. Because I don't want them coming in here, wasting a consult fee, and for me to tell them I can't help them. That's devastating.
Right.
So I'll tell them before they come in that, hey, listen, based on all these questions, we have a huge questionnaire, that I didn't say anyone, I don't think I can help you. And she was so mad that I didn't bring her in to evaluate her when we're trying to save her the agony. It was just, it was ironic. Anyways, I understand. In her instance, she was so unhappy that she was praying that somebody would fix it. I felt bad all around. At any rate, so any imparting wisdom for people either who are contemplating a rhinoplasty, because you are a rhinoplasty patient, and or contemplating a revision since you are a revision patient, anything you would share with anybody before?
I think when I started this journey and I knew I wanted to do this and was researching surgeons, and had met you during my consult. I think a huge reason that I chose you was that you were very honest with me. You educated me really well on all possible scenarios and outcomes. And it just felt like a really good match based on your work that I'd seen previously. There's just different things that made me feel comfortable that I know this is a doctor that does great work, but also stands behind what he's doing. And I can just get all of that from our conversations and the preparation and the whole team at your office that was working with me together. So I felt very comfortable. I felt really good. And if someone is researching and trying to make that decision, if you don't have all of those things or it doesn't feel good, like I wouldn't move forward with that surgeon. Because if this were to happen, as it did in our case, we had a great relationship. We had a great foundation. And we were really able to work as a team to figure out a solution for what was best to move forward.
Yeah, and I think that's a great ending point, which is what I always say is you're selecting a great surgeon for when things go wrong.
Yes.
You are selecting them as the insurance policy because when everything goes great, everyone's great. But when things don't go as you had anticipated or planned, which happens in every surgeon, the question is, how do you and your surgeon respond then?
Right.
And I think that's when you realize if you pick the right surgeon, just the same way you find out if you marry the right person, right? Not when you guys are on vacation, but when the shit hits the fan. So well said. All right, well, we're so grateful that you came. I'm so happy that you're happy. And I think this was a very valuable discussion that people are going to really appreciate it. So guys, that's a wrap on Plastic Surgery Uncensored for this particular episode. As always, our parting two wishes are one, if you enjoy the show, please share this episode with friends and family. You got to get the message out because you don't actually know who's considering what, when, where, and only to find out afterwards like, oh, why didn't you tell me? Just pass on the information. The second is if you enjoy our show, you find it to be educational, end this podcast, go on and write us something positive. Positive reviews make everyone want to come to work and do the job. So again, thank you so much for coming. I appreciate it. You look fantastic. And until next week, I'm your host, Dr. Rady Rahban, signing off on Plastic Surgery Uncensored.